everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Mercy Mary, popularly known as the Nurse with the Difference, and I make learning easy and accessible for students. Today we're going to be talking about peptic ulcer. What is peptic ulcer? What are the causes of peptic ulcer? What are the various types of peptic ulcer? What is the nursing management, the diagnostic evaluation, the pharmacological management, the nursing diagnosis, and also the complication of peptic ulcer? By the end of this class, you will be able to answer all these questions correctly. But before we go into details, you know what to do. Kindly click on the subscribe button. Turn on the notification button if you've not done so, so you don't miss out. Let's go there. Alright, welcome back. Like I earlier told you today, we're going to be talking about peptic ulcer. The first question is, what is peptic ulcer? Peptic ulcer is an excavation that forms in the mucosal wall of the stomach, duodenum, or the esophagus. Is an what? Is an excavation. Peptic ulcer can also be seen as the erosion of the mucosal lining of either the stomach, the esophagus, and the duodenum. Most of us, when we hear about the word peptic ulcer, we feel it's just the stomach that is being affected. Depending on the type of peptic ulcer, that is when we can say, okay, it's just the stomach that is affected. So peptic ulcer is what? Is an erosion, or you can say is an excavation that forms in the mucosal wall. The mucosal wall, remember in our anatomy and physiology of the stomach, the mucosal wall, the mucosal lining is the innermost layer of the stomach. Is what? The innermost layer of the stomach. So when there is an erosion, when there is an excavation of the mucosal lining of the stomach, the esophagus, or the duodenum, we say peptic ulcer has occurred. Then that takes us to the types of peptic ulcer. There are basically three types of peptic ulcer. As the name implies, the first is gastric ulcer. Gastric ulcer is a type of peptic ulcer that occurs in the stomach. It occurs around the lesser curvature and the pylorus. That is where your gastric ulcer normally occurs. Gastric ulcer occurs where? In the stomach. Then the second type of peptic ulcer we have is the duodenal ulcer. As the name implies, the ulcer that affects the duodenum, the erosion, the excavation of the duodenum. Then the other type we have is esophageal ulcer. As the name implies, esophageal, it simply means esophagus. So in esophageal ulcer, the esophagus is being affected. So it's very easy to remember the types of ulcer. We have the gastric ulcer, which affects where? The stomach. We have the duodenal ulcer, which affects the duodenum. And we also have the esophageal ulcer, which affects the esophagus. Then that takes us to the causes of ulcer. Most times when we are asked what are the causes of ulcer, I hear people saying too much food, hunger, spicy food. These are the causes of ulcer. Is this really the cause of ulcer? Research shows that 80 to 90% of the type of ulcer you see, or the ulcer that happens, are as a result of a bacteria known as Helicobacter pylori. So one of the major causes of ulcer is what? Helicobacter pylori. When I heard about this organism, what came to my mind was that the stomach is acidic. The stomach is acidic. I was thinking when this bacteria gets into the stomach, the acid nature of the stomach ought to swallow up this bacteria, ought to kill this bacteria. But I found out that The Helicobacter pylori is actually very, very smart. What it does is that it releases urease. This urease finally there is a neutralization reaction that neutralizes that acid area and enables the Helicobacter pylori carry out its function very, very well. So the first major cause of peptic ulcer, like I earlier said, is what? Helicobacter pylori. Then the second is NSAID. NSAID simply means non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs. How do they cause ulcer? In the stomach, there's what we call prostaglandins. The prostaglandins help to protect the mucosal lining of the stomach. But when you continuously take NSAID as a result of pain, as a result of osteoarthritis, as a result of pain. So when you continuously take NSAID, what it do is that it reduces the prostaglandins in the stomach. It reduces what? It reduces the prostaglandins. And when the prostaglandins is reduced, the mucosal lining is no longer protected or defended as usual. So NSAID is also one of the cause of what? Peptic ulcer. Then other risk factor to peptic ulcer are, we have excessive smoking. Excessive smoking is a risk factor. Alcohol injection is a risk factor. Caffeinated drink, caffeines, is a risk factor. Familial tendency is a risk factor. And also ulcer is common among blood group O. So that is that for the various causes of what? Peptic ulcer. Then that takes us to the pathophysiology of peptic ulcer. It's as simple as this. As what is the structure on the board? First of all is that the various causes, what they do is to what? They cause erosion of the gastric mucosa, excavation of the gastric mucosa, excavation of the inner lining of the stomach. When these excavations occurs, the mucosal lining is hot, the mucosal lining is pained, is annoyed because the mucosal lining has just been tampered with. So what happens is that there is a release of histamine. There's a release of what? Histamine. And when histamine is released, it increases the further secretion of gastric acid. Are you seeing the funny thing now? There's an erosion of the mucosa. The erosion of the mucosa leads to the release of histamine. And when this histamine is released, it leads to what? The further secretion of what? Gastric acid. There is now autodigestion. You know when we say autodigestion, it simply means something like the stomach is eating itself up. You get? Because at this moment, acid is coming in contact with the eroded layer. So there's what? Autodigestion, there's mucosal edema and inflammation, and there's also erosion of the blood vessels. For exam condition, for those that will be writing the nursing and midwifery professional exams, we have an acronym, or we have a pattern on how we write our pathophysiology for exams. You can send a message to the WhatsApp number written in the about section of this video. So there's erosion of the blood vessels that results in the following signs and symptoms you see. So this full pathophysiology results in this pain. There is hemorrhage. This hemorrhage could be hematemesis, which is vomiting blood, or it could be melena, which is passing out feces alongside with blood. There's a mixture of the feces with blood. That's fecal matter with blood. So it could be what they call hematemesis or melena. Then the other is tenderness of the abdomen. You know when something is tender, there's tenderness of the abdomen. There is nausea and vomiting. It's the digestive system that's been affected. So you should expect nausea and vomiting. There is weight loss, there's anorexia, and there's constipation. Whenever I see anorexia in a sign and symptom of a particular disease condition, the next thing that comes to mind also as a sign and symptoms is weight loss. Because if I'm not eating, definitely I'm going to lose weight. Then that takes us to the management of peptic ulcer. Let's talk about the pharmacological management of peptic ulcer. When we say pharmacological management, we simply mean the drugs for peptic ulcer. And the first class we have here is the antacid. The antacid helps to neutralize the acid, helps in a neutralization reaction. And examples of such antacids are aluminium hydroxide, magnesium hydroxide, and calcium carbonate. Another class of drugs used for peptic ulcer is histamine 2 receptor blockers. Remember in our class when we were talking about the pathophysiology of peptic ulcer, we said that there is release of what? There is release of histamine, and this histamine increase further gastric acid production. So in such a case, we have to block the histamine so that acid will not be released, so that hydrochloric acid will not be released. So that is the job of what? Histamine 2 receptor blockers. An example of the histamine 2 receptor blockers are the cimetidine, ranitidine, and famotidine. Then the other is the antibiotics. The antibiotics, as the name implies, help to fight bacterial infection. An example of that is your clarithromycin, amoxicillin, and tetracycline. Then another class of drugs is the cytoprotective agent. The cytoprotective agent helps to protect the mucosal lining so it does not get too invaded or something. An example of that is your misoprostol, which is known as your cytotec, and also your sucralfate. Then another class of drugs which is used for peptic ulcer, I think this is very common here, and that is proton pump inhibitor, and that helps to interfere with the final transfer of hydrogen ion into the gastric lumen. Example of that is omeprazole. Now that takes us to the diagnostic evaluation for peptic ulcer. The first one I have here is test for Helicobacter pylori. The organism, that's the Helicobacter pylori, they may be detected in blood tests, they may be detected in stool, and they may also be detected with breath test, breath in, breath out. So the second diagnostic evaluation we have here is endoscopy, we have biopsy, we have radiological examination, we have stool for occult blood, then we have gastric secretion analysis. Source to the nursing diagnosis for peptic ulcer. The first one we have here is acute pain related to the effect of gastric acid secretion on damaged tissue. Acute pain related to the effect of gastric acid secretion on damaged tissue, evidenced by patient verbalization. The second nursing diagnosis we have is imbalanced nutrition less than body requirement related to change in diet, evidenced by weight loss. We might have anxiety. We can also have deficient knowledge. For those that are having difficulty writing nursing care plan, you can also send us a message and you will get instant reply on how to go about your registration. Then the other is a nursing management for peptic ulcer. Like I will always tell you in all my videos, we use apodeceral as a guide when writing nursing management. But the important fact I want you to take note of when it comes to peptic ulcer management is that as a nurse, you are managing for pain, because this patient is in severe pain. You have to talk about giving diversional therapy. You have to talk about giving prescribed analgesics, giving prescribed pain relief, and giving the prescribed medication in general. Then also nutrition and diet. For peptic ulcer, there is a change in diet. This patient has to start taking bland diet and stop taking diet that will aggravate that pain. That is why you have to involve the patient in the care. Because the patient is going to tell you that, oh, after taking this, I feel severe pain. After this, I have severe pain. This aggravates my pain. Yeah, so there's going to be a change in diet for a peptic ulcer patient. Then the last one is health education. The fact is, the importance of health education in nursing should not be underestimated. because most of our patients are not aware of the risk factors of peptic ulcer. They are not aware of the things that are likely going to aggravate peptic ulcer. So that is why you have to educate them on the importance of reducing caffeinated drinks, the importance of taking enough bland diets rather than caffeinated food. You have to tell them the importance of quitting smoking, the importance of reducing alcohol intake, and you also have to tell them how to prepare food that are likely going to suit the gastric, the stomach region, or the eroded mucosa. Then in terms of the complication of peptic ulcer, we have hemorrhage, we have perforation, we have pyloric obstruction, and we have penetration. That is all on peptic ulcer today. Don't forget to drop your question in the comment section. Don't also forget to ask your questions. Don't forget to drop your contributions in the comment section. Don't forget to like. Don't forget to share. And don't forget to watch with a friend if you know you got value. Thanks, and have a wonderful day ahead.